What's going on, everyone? Happy Monday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and testing negative for all those viruses that can make us sick if you did have to take a test. It is time now for the Monday edition of the Virus Update for Monday, October 20th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. I give you the latest news, information, data, really anything I can find to help keep you safe and informed. Why do I do this? Because there's really hardly anyone out there doing this, and you really need to know about what's going on. Hey, did you know some parts of the world are dealing with record numbers of flu? Yeah, that's probably why you clicked on this video, and we're going to hear about that in just a little bit. If you're new here, subscribe down below. If you like today's video, give it a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Already, we do have several things to get through today in the news department. Then we're going to take a look at some of our daily data, and we will do some more wastewater sites. In fact, we'll do somewhere between about 5 to 10 wastewater sites today because, let's face it, we didn't get to enough yesterday. Yesterday was Wastewater Sunday, but there was so much news we just didn't have enough time to get through many. So starting off with this, in Australia, the Queensland Weekly Respiratory Surveillance Report for October 14th to October 20th, 2025 reported cases of COVID 259. Hey, that's down by 14.5%. Influenza 1,143 cases. That's down by 1.8%, but again, you are seeing very high levels of influenza, not just in Queensland, really all over Australia. Influenza has been a big problem. RSV, 458 cases. Hey, not good there. That's up by 3.8%. Hospitalizations, 25 for COVID. That's down by 7.4%. Influenza, 56. That's stable. RSV, 26. That's down by 38%. We'll have to see if RSV hospitalizations go up next week because there was that little bit of an increase in cases, which we know hospitalizations for all viruses lag someone testing positive. First you test positive, then you're hospitalized. Hey, sometimes it's you're testing positive while in the hospital. All right, moving on to this. Millions of us have likely lost our smell without realizing it. Yeah, this is not good. New research shows many people may have lost their sense of smell after catching COVID-19 without realizing it. Another lingering impact of the ongoing pandemic. And I might add, some people may have lost their smell, but don't want to connect the dots to COVID. Or maybe they didn't really have symptoms and they had an asymptomatic case. Yes, you can have an asymptomatic case of COVID and still lose your sense of smell. I think there's a lot of people out there that just don't realize it's from COVID or vice versa. Many people had COVID and aren't realizing, hey, things aren't smelling correct. Is that a thing for you? Yeah, I can't say it's a thing for me. I think I can still smell things just fine after 2 COVID infections, but what do I know? Maybe things are smelling a little bit funky. All right, got to go back to Australia. We should have had this queued up first. I don't know why we didn't, but the reason why you clicked on this video. Hey, record flu season in Australia. Yes, Australia is being hit by a record flu season. More than 410,000 confirmed cases so far in 2025. And if we go back to Queensland for just a second, well, Queensland alone added another 1,143 cases. I don't know if that's included in this report, but yeah, flu's really bad. Only 25.7% of children aged 6 months to 5 years were vaccinated in 2025. That's the lowest since 2021. Vaccination rates for over 65 slipped to 60.5%, the lowest since 2020. The big takeaway here is flu cases. Again, a record number there. That's a bad sign of what's to come in other places around the world. We're already seeing in the UK, flu is significantly rising. In fact, you know what? I wasn't planning on doing this. I think we may click on the UK dashboard just because the fact that things there are not going in the right direction right now. So maybe we'll take a look at that in just a couple seconds. Let's move on now to this. Last year's flu season was California's worst in years. Why this year could potentially be just as bad? Well, I'll give you one big reason. We just saw Australia's having a record flu season. Also, we're seeing what's going on over in Asia as well. Let's read a little bit here. Health officials warn this year's flu season could be severe, with early outbreaks already hitting epidemic levels in Asia. Some are raising concerns about lower flu vaccination rates as California heads into the respiratory virus season. This is coming from the LA Times. I think I will do a thread today. You may get paywalled on this site. This site may be a paywall site for you if you've viewed so many different things there. All right, take a look at Wales when it comes to COVID. And XFG remains the most common variant within the lines of XFG 0.3, 0.4, 0.1 has increased in the last reported week. So that's something to keep an eye on. And while we're at it, let's just go over to that UK dashboard now, shall we? Yeah, we'll click on this next. And I want to show you influenza. You can clearly see here, influenza positivity rate is rising. It is up to 6.8%. That's up more than 0.5% in the last 7 days. You can clearly see it's going up, and it's going to continue to go up. It's going up in all age groups at this time. Can we actually click and make this image bigger? No, we cannot. But you can see here, it is clearly going up in all age groups. This is coming after Australia, once again, had a record-breaking flu season, which, by the way, over there, it's not done yet. So that's not good whatsoever. All right, I thought this was interesting. This was making its rounds on social media. Let's just go straight to the source. Believe it or not, Rolling Stone, you know Rolling Stone magazine, long COVID is real, and it's changing an entire generation. I'm just showing this to you because they're actually acknowledging long COVID. Hundreds of thousands of kids in America are struggling with an illness that many doctors and schools refuse to recognize. Oh, this is, it's 100% accurate. I mean, they hit a grand slam when they decided to do this because it's the truth. Long COVID is impacting hundreds of thousands of kids, and around the world, millions of people, not just kids, all ages. If you include around the world, all ages in the United States as well. But, you know, these testing scores being lower, kids struggling to stay awake in school, all these different things that really weren't the case several years ago. Yeah, there's a link to long COVID. Kids are getting infected again and again, and it is not a good thing. Hey, speaking of kids, look at this. New study suggests long COVID is now most common childhood chronic health problem. Really? But yet we have an administration that, well, I shouldn't even blame this administration. Why should I go there? No. We have everyone in general that doesn't want to do anything about it. There's very few people out there that actually want to acknowledge how bad of a problem this is, but here we are. We sit and think all is fine and try and put the blame on this, that, or something else. Well, the problem was because they actually missed time in school. Like, no, that's not the problem. The problem is there's a virus that no one wants to contain, no one wants to do anything about. We just allow it to continue to mutate, and we think it's okay that people get sick again and again and again and again. And here we are. We're starting to see the fallout from that. It's a real problem. Do I even need to read on? No, I'm not going to, because with something that we've touched on many times before, and it's not the last time you're going to hear me talk about it. All right, hand, foot, and mouth disease confirmed in Green Bay area public schools. More cases of another virus that can get serious. As a matter of fact, it can cause kids to miss school, and if there's enough cases, schools can get shut down. It's just an ongoing problem, all these different issues that no one wants to do about. I apologize. I said something a couple minutes ago. I blame this current administration for doing something. I shouldn't do that. It's just, let's face it, no one wants to acknowledge anything. And it just frustrates me. And when I get frustrated, I sometimes say things maybe I shouldn't. All right, let's switch gears. Let's go to wildlife now. Let's talk about chronic wasting disease, or sometimes referred to as zombie deer disease. Yes, Florida now has a new case of it. Florida wildlife officials discovered second case of zombie deer disease. Chronic wasting disease is the best way to say it. That's the way we know about it. Yeah, chronic wasting disease is a problem, and I believe this is in, I'm not seeing it here. I believe it's in Holcomb County. There it is, or excuse me, Holmes County, Florida, is where this is a problem. Up close to the Alabama border. So this is on the Florida Panhandle. And we have another report of chronic wasting disease. 2 Oklahoma deer have tested positive for chronic wasting disease. So it's out there. It's still spreading, and it continues to become a bigger problem. Alrighty, do I have anything to show you on the website? Well, I can tell you this much. It was a very busy weekend for the tracking threads. I can show you that right here. Here's those tracking threads, where I keep track of all these viruses that make us sick. And you can see here just the dates from over the weekend. Yeah, the majority of the tracking threads did get an update of some sort because there were a lot of things going on. We'll see if I find anything today. I looked a little bit earlier, didn't see much of anything, but who knows? The day's only about halfway through. It's only 2:30 in the afternoon. Sometimes the second half, a whole bunch of things pop up. Take a look at this. U.S. sports illness is getting a lot of interest. Almost 23,000 views on that. It just blows my mind. There's that many people searching and say, just what the heck is going on? Why are all these sports players ill? And yeah, that's going to pick up the pace soon. NBA's coming back. You remember last year, National Basketball Association had a horrible issue when it comes to people sick. Take a look at this. Bird migration was really heavy over the last 24 hours. Yeah, take a look at that. It hit 600 million birds at the peak last night. And you can see the Great Lakes down to the southeast, that migration from north to south. It is definitely ongoing right now, and that could potentially spread bird flu. Let's take a look at air qualities. But while we're waiting for that to load, let's pause and take a hydration break, shall we? Alrighty. Air qualities across the United States are really good unless you're in a couple of regions. First off, extreme southern Texas and the West Coast. You can see parts of California, Oregon, Washington dealing with some oranges and reds. Those are some pretty bad air qualities, something you should be mindful of. You do want to pay close attention if you're in that area, especially if you have known breathing issues. Taking a look at EMS now. Florida, Pinellas County, Florida. Few sick person calls, few other problems going on. And we do see a couple delays here. Of course, that's not a good thing. That means delay trying to get into the emergency department or trying to find a bed. In Philadelphia on Sunday, very good. 679 EMS incidents reported, but EMS has been busy today. Taking a live look at Montgomery County, 13 calls right now. That's about normal. Chester County is the one that was busy earlier. Yeah, I'm still seeing 3 sick person calls. It's been continuous. Number of sick person calls pretty much all day long there. Earlier at one point, they were well north of a dozen different calls. Taking a look at Bucks County, Pennsylvania. Yeah, up to 13 calls here now, so this is busy as well. Hospitals in Pennsylvania are not doing too bad today. I'll show you that in just a moment because I have to show you this first. We're now listed very low for COVID and wastewater in Pennsylvania, and someone's probably saying, oh, you don't seem very happy about that. Well, it's not that I'm not happy about that. I actually am. If that's to be correct, I'm happy about that. The problem is the data has been switching so many times, but take a look here. You do see there are a lot of wastewater sites that are very low, but also each region, or almost each region, does have at least one wastewater site where very high is coming up in play. Southwest Pennsylvania, Erie, Pennsylvania, up there in northwest Pennsylvania. Also northeast Pennsylvania does have high and almost very high levels showing up. So that's something we have to be concerned about. But take a look here. There's these big gaps in between the data. I don't know why that is. Maybe they weren't updating these wastewater sites in the summertime. That's very well possible. And now that we're coming into winter, maybe we will see updates. Maybe there's some sort of regulation where they're not required to update as frequent in summertime versus the colder months. That could definitely be a thing. Again, hospital situation in Pennsylvania, not doing too bad. We do see some hospitals in Southeast PA dealing with a problem today. Westchester, haven't seen that listed in a while. What's going on there? High patient volume, 21 inpatient boarders, 10 BH patients. Yeah, expect long wait times. That hospital just sounds like it's an absolute disaster right now. New Jersey does have several hospitals with issues today. AHS Newton, let's refresh this to make sure it's up to date. AH Newton, no cath lab facilities at this time. Capital Health Regional Medical Center, Adult Emergency Department, divert at this time. Central State Medical Center is also dealing with a divert at this time. And I thought there was another hospital. Yes, RWJBH University Hospital Hamilton is dealing with a patient volume issue at this time. New York State, let's refresh these cases. We'll at least get a case update. 430 cases, if that is the latest update. And still nothing for hospitalizations? No, we haven't seen anything since October 7th. So what was supposed to be every week? Yeah, I don't even think they're doing that at the moment. Yeah, not a good thing. All right, let's move over to wastewater here in the United States. We'll do at least 5 wastewater sites, and there's a few that we haven't looked at in a while. Let's do that today. Starting off with COVID, we see nationally, COVID is medium in the West, the Midwest, low in the South, and low in the Northeast. Let's go to West Virginia. I believe the one wastewater site there is Wheeling, West Virginia. Hey, if you're from West Virginia and you're watching this video, check in with the comments down below. Maybe I will get back to you. I know, I'm behind on comments. We intend to catch up on all the comments this evening. Alright, Wheeling, West Virginia. Medium for COVID and dropping at this time. RSV is low. Influenza A, Influenza B, HMPV, all those viruses are still low. Norovirus is also listed at low at this time. There are detections of norovirus in wastewater. Hepatitis A, some recent detections of that at this time. So that's Wheeling, West Virginia. Let's go down to the south now. Hey, things are looking pretty good in the Atlanta area. Let's take a look at Roswell, Georgia. Now, they were medium for COVID. That is going up ever so slightly. RSV is being detected, Influenza A is being detected, and norovirus, yeah, your norovirus levels are going up rather quickly at this time. Let's go down to Florida. We've had a problem in Florida that has cropped up over the last several days, and that is Orange County, Florida. Yeah, COVID's starting to go up there in southwest Orange County, Florida. Norovirus was pretty high. It dropped. Now it's starting to go up once again. And take a look at this. Mpox clade 2, back on October 2nd, was detected. And now let's go over to the other wastewater facility there, Eastern Orange County. That's starting to go up for COVID as well. I don't know, this seems rather early for anywhere in Florida to go up because, remember, the colder months, you generally do not get hit as hard as you did in the summertime. Norovirus is medium and rising. One thing you will get hit hard with, you're not doing so just yet. Down the line, flu. Flu is going to be something that hits everywhere across the United States hard. We're seeing those signals around other parts of the world, and eventually it's going to be the case here in the United States. All right, let's go to Dallas, Texas. Haven't checked that in a while. Central Dallas is still doing okay for COVID. Just one detection of influenza back in September. Everything else is fine, although norovirus is medium and starting to rise slightly at this time. Let's go out to the West Coast. Unfortunately, we can't do much of anything for the Pacific Northwest. There's just that Snohomish. We'll look at Snohomish, Washington in just a moment. With CDC being out, we really miss out on several states. So Montana, Wyoming. Yeah, I apologize, guys. I wish I could give you some data. I'll check some state dashboards to see if there's anything I can find. Las Vegas, Nevada is low at this time for COVID. But when we come down to the other viruses, yeah, that's not doing bad either. Measles, there was a detection way back in August. Influenza, RSV, not doing bad. And norovirus is still fine at this time. Going up to Snohomish, Washington. This will be our second to the last wastewater site. Our last one will be somewhere in the Midwest. Snohomish, Washington is high for COVID. Yeah, it actually went up a little bit again starting off October. Then it went down on the most recent update. Gonna have to keep an eye on that. HMPV is showing up in wastewater. Norovirus is okay at this time. Everything else is still fine. We're awaiting some detections of influenza A. I think, again, a lot of these wastewater sites are gonna really start to show some detections post-Halloween in just a few weeks. Alright, let's go to the Midwest. Where do we want to go to in the Midwest? How about we go to Lincoln, Nebraska, shall we? That's actually the plains. Close enough. Medium for COVID in wastewater at this time and dropping. RSV is low. There was a detection of influenza A back in August. Nothing now. Influenza B is fine. Medium for norovirus, although that's come down a little bit. And everything else is fine at this time. Alrighty, that does it for today's virus update. If you enjoyed it, hit that thumbs up button down below. Let's try for 150 like button hits today. Hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. I promise. All those comments from other videos, I will catch up on them today. And that's it. I will see you all again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Monday afternoon. Thanks for watching.